Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Mwaka. First, the highlights. Fear grips frontline workers in Edo State as health workers test positive for coronavirus. Ebonyi State Governor Dave Umahi wields the big stick, bans all nightclub activities following increased infections. And the European Union laments vaccine supply delay from Pfizer. And from the Nigeria Center for Disease Control (NCDC), school authorities must ensure all parents, guardians are communicated to in the event of a COVID-19 confirmed case in the school. Now, the center believes that protecting all students is a collective role. In the meantime, it announced close to 2,000 cases in Nigeria last night and 7 deaths. The new cases are reported from 23 states and the FCT, with Lagos recording the highest at 824, followed by the FCT, Plateau, Kaduna, Ogun, Nasarawa. You can see the cases and the states there on your screen. Now, till date, 116,655 cases have been confirmed. 93,646 have been discharged, and the death toll is at 1,485. These deaths have been recorded in the 36 states and the Federal Capital Territory. Now, this week, the coronavirus COVID-19 update program came back on stream due to the second wave and the number of daily tally the country and the rest of the world has been witnessing. But before we go forward, let's look at what it used to be. And we're looking at the year Nigeria recorded its very first case, 2020. And you can see there that's showing February. Now, this were the numbers essentially talking about when we recorded the case at that time, the month of February, and up until our peak, which was sometime in July and August, where some states claimed that, yes, indeed, they had peaked. And before you know it, we saw that the cases slightly dropped. We were recording a little bit over 300 and a few other cases into October and December. But it takes us to our second slide, which was blamed on several things, Christmas holidays and New Year holidays as well. And some cases, some people said prevention fatigue. Countries began recording the second wave more intensely than ever. And what you're seeing here is the peak of January, which isn't over. This is just the 22nd day. But then this is our curve here in Nigeria, and we reported close to 2,000 for the very first time just yesterday. Our next slide, you see that it takes us from data from Friday, the 15th, up until Thursday, the 21st. So we're seeing that Lagos is appearing quite often, and it is taking a larger chunk of the cases we're seeing each day. Another regular as well is the FCT. You can also see Plateau there, and there is Kaduna. We're looking at the top 4 states that have been recording cases, highest cases in our daily tally, and these have been the numbers recorded by the NCDC so far in Nigeria. Now, many reasons have been given for the second wave: human behavior, travel, ill preparation, and that is coming from an Oxford researcher who said that several countries had a lot of time to prepare, especially the experiences they learned in the first wave than what we're seeing in the second wave. We have countries like New Zealand, for example, that hasn't had a COVID-19 death except the last time was in September. And essentially, we're being told that until the vaccines are produced, until they arrive, these are what we must continue to do: to wash our hands, to use the hand sanitizers, not to touch our face, to stay home if we feel sick, and several of the other protocols essentially. But let's go over to what we're hearing now, and this is coming in from Edo State. Results were done, health workers there, they've turned positive, and we're looking at 39 of them. And this is amongst the numbers that were screened. This was announced by the Permanent Secretary, the Edo State Ministry of Health, Dr. Osamoyi Irowa, who says the treatment of the virus is entering a critical stage, especially where frontline workers are concerned.
In the last 72 hours, we have had a total of 39 healthcare workers infected for COVID-19 from our screening. And this number is actually a critical number to us because healthcare workers are the ones that take care of those who are not negative, and those who are also those who are positive and those who are also not positive. So essentially, it is critical that we make sure that healthcare workers are duly protected and also they comply with the same protocols that we have for the entire society or communities. It is our own duty to ensure that we pull those healthcare workers out of the system so that they don't also infect patients. And that is critical to us because there are not too many in the system that care for these patients. So losing one of them to the COVID-19 and not being able to render services to the people is actually not a very good news. So going forward for the state, we are doing everything possible to ensure that the healthcare workers are properly protected by way of giving them the appropriate personal protective equipment and for them to also follow the protocols already designed and being implemented in Edo State.
Over in Ekiti State, government workers on grade levels 12 and below are still excused from workplaces, but the state government has relaxed the 8 p.m. to 6 a.m. curfew to between 10 p.m. and 6 a.m. Our correspondent Babajide Egbeyo gives us this update.
Some of the restrictions imposed on Ekiti State have been relaxed by the state government. Now, more than 20 people can attend public events, and such event centers must not exceed more than half of its capacity, and all COVID-19 protocols are expected to be complied with. For worship centers, they can also hold more than 2 services in a week now, while they are expected to still comply with all the protocols. Schools have reopened earlier in the week across the state, as the state government says it is imperative that this is done so as not to jeopardize the education and future of the young ones.
Government has been very insincere. The same government that directed us to observe those protocols was the same government during that first wave of COVID-19 that held election in Edo. We saw the rallies in Edo, we saw the rallies in Ondo. Nobody was keeping social distancing. Government representatives were there, state governors were there. So what are we saying? You did all that and you are telling me to be forcing myself to do what I was not used to. As an individual, I take responsibilities for myself, for my household.
Any risk in even you not using face mask?
I have my own here now. They say we should put it on. Ready to put it on.
But the state government had always insisted that people need to take responsibility and personalize the issue of safety. In all this, it is expedient that people really understand the reasons behind these measures and protocols and take responsibility even without supervision. Babajide Egbeyo for COVID-19 update.
And Dr. Taufik Sane is the immediate past president, Association of Resident Doctors, Ekiti State. He joins us now. We'd like to thank you for joining us on the program. Some fatigue we're seeing there in Ekiti State, but I'd like to begin with what it appears we're seeing, the number of infections among health workers being disproportionately higher than the public. I'd like to get your thoughts on what you think is responsible.
Thank you very much for having me. Healthcare workers are one of the set of people who are at risk of contracting COVID-19 because many who are infected will come to the hospital and they will have contact with doctors, nurses, and other healthcare workers. And that makes them to be very, very highly at risk. Therefore, if we don't want them to come down with COVID-19, they must also observe protocols and guidelines of COVID-19, and they must be given personal protective equipment. Doctors will have no choice than to have contact with their patient through treatment, during examination, during surgeries, and some other procedures. They have no choice. They cannot observe physical distancing at those points in time, though they might need to have contact with their patient. And the only thing that can protect doctors and prevent them from contacting COVID-19 from infected patients is for them to use their personal protective equipment, use of face masks, face shield, and gloves, they use head cover. They need to also even use apron so that the secretion of the infected individuals will not have contact with their bodies. But what we have observed is that most hospitals do not have this personal protective equipment. They are not available. So doctors are forced to manage what they have to treat this patient. And if decide not to treat patient, you can be sued for negligence of duty. So you are in between neglecting your work and also having safety while you do your work. And that's why we've always canvassed that government should provide personal protective equipment. Let them be available. Let us use them per patient. And with this, we can protect healthcare workers. What we don't know is that whatever we do to protect healthcare workers, we're not doing for them alone. We're also doing it to increase productivity. If healthcare workers contact COVID-19 virus and they go on isolation, that will reduce the workforce and that will also reduce the delivery to the people of the country. Therefore, we must do everything to protect healthcare workers. They will always be there to provide services. Any healthcare worker lost to COVID-19 is a reduction in our manpower. Any healthcare worker that contact COVID-19, we have to go into isolation the way other people go into isolation. And that will also be a reduction of manpower. And we're in a country where we are complaining of even health resources in terms of manpower and losing anyone to COVID-19. Yes, sir.
Let's look at the numbers coming in from Ekiti State. I mean, it doesn't appear that they have a lot of confirmed cases as the majority of the states. In fact, in terms of the tally, I think you can find Ekiti State at the bottom 10 also in terms of the numbers. What would you say the state is doing differently?
Yes, what we're advocating is number one, if you want people to comply with the protocols, they must be health educated. We must look at behavioral changes, health education. If people are not well educated, if they are not enlightened, if they are not aware, they are not likely to go along with the guideline and they are not likely to respect the guideline. During the first wave, the government did things by sending out text messages through various telecommunication companies with these text messages every day. Even the media houses, the print, the virtual, and the audio media houses are rolling out enlightenment campaign programs to tell people that we have COVID-19 with us and to tell people that we must protect ourselves. Those things are not being done in many countries, in many parts of the country today. And maybe we are doing that in Ekiti State. We are enlightening people. We are talking to people more. And also, when people are well educated, they will be able to now observe the protocols. They will use their face masks because they know that once they use it, they are using it to prevent themselves. We all know that with this vaccination that will be coming into the country very soon, all over the world, in the next few months or maybe a year, we should be able to overcome COVID-19. And it is only the people who are living at that time that will be able to celebrate the end of COVID-19. So everybody presently must take responsibility for their health. And that will be because they understand the reason why they must do so. So they must use their face masks. We are preaching physical distancing all around now. We are saying everybody should wash their hands regularly and use hand sanitizers. And also mass screening is being done. When mass screening is done, the people who are infected will be identified easily. They will be isolated. That will also reduce the risk of infecting other people in the population. I think if we do all this, we should be able to overcome COVID-19 infection.
We appreciate your time, Dr. Taufik Sani is immediate past president, Association of Resident Doctors, Ekiti State. Thank you for joining us.
Thank you very much for having me.
Now, more and more measures are being applied by state governments in Nigeria in continuation of efforts to stop and the spread of the second wave. This time, the Ebonyi state government has banned nightclubs from operating and reduced the hours for church services to 2. The governor made the comments while flagging off the COVID-19 compliance campaign in the state capital.
Effective from tomorrow morning, we are banning all drinking places and cinema, all drinking places, all dancing places, nightclubs, and we have to dust our COVID law and begin to implement it immediately. This is the first step we are taking in terms of public engagement. We've already begged the religious bodies to limit the hours of worshiping our God to 2 hours, and to insist that, I'm happy the Khan chairman is here. I hope the Muslim community is also here, to insist that people wear their mask. The committee should also go into the net and see how we can import equipment for oxygen production. It is possible, it is doable. Beyond the COVID, we also use it in our subsequent engagement.
Now let's talk to Dr. Adejo Arome. He's the first Vice President, National Association Resident Doctors NARD. He joins us now from Abuja. Thank you for joining us. And I want to begin also with the plight we're seeing, the number of health care workers, the frontline workers who are contracting COVID-19. What do you think is responsible? The earlier doctor we spoke to from Ekiti said that it's inadequate PPEs and the likes, and improper physical distancing even in the hospitals. What's your take?
Thank you very much. Good evening to our viewers at home. I must tell you that the morals among we doctors is very, very low at this point in time. It's so disheartening that the number of health workers being infected with COVID-19 is increasing daily, and it seems nothing is being done to reduce this number. And apart from that, I just heard that this evening that almost all the doctors in UCH pediatric department are infected. Dash Lafia, almost all the doctors there are infected. It's like that every day. In fact, right now, I believe that every doctor in clinical practice right now should have been exposed to COVID-19. I was on treatment, though I didn't have the test done because I couldn't have access to the test. Well, my distinguished colleague has done justice to it. Apart from personal protective equipment, what I feel is one of the major things causing this is that patients don't come out truthfully to tell us their symptoms, because almost everybody now knows what are the symptoms of COVID-19. They will go to one hospital, the doctor there will tell them that this is what he's suspecting. They will run away, go to another one, praying and thinking to hear another diagnosis. I think this is wrong, and I think it is high time that the federal government step up and bring up policies that will make it unlawful for patients and their relatives to come to the hospital and lie to doctors, because by so doing, they are currently exposing us, exposing our families. And to even think of it, we have no insurance, and our hazard allowance is just mere 5,000 naira. It's pathetic and it's very sad.
I have two other theories to bring to your notice. And one is that we hear the presentation of COVID-19 is not as straightforward as in the second wave. Can you tell us a bit more about that?
The truth is that there are some unique issues that is common to both. But you see, with viral illnesses, it cannot be specific. Yeah, presentation can differ depending on the person's strength, depending on the person's inbuilt immunity. Someone who has strong immunity, the presentation will be quite different from the ones that have low one. So, as I said, in the pandemic, every patient coming into your consulting room is suspected to have COVID-19 until proven otherwise. But the truth is, when we don't have everything that we need to work with, you don't expect the doctor that is treating the patient not to examine the patient. And you go to some hospitals, they give a doctor one face mask for 2 days. You don't even have gloves. You keep on writing prescription for patients to buy gloves. You as a doctor, you will feel bad. Some people don't even have food to eat. So why should you be writing them prescription to be buying gloves? So based on your human sympathy, at the end of the day, you will forget what it takes to keep yourself safe. And by so doing, you end up exposing yourself. And once one of us get them exposed, you end up exposing more than 4,000 patients, because doctor-patient ratio in this country is 1 to 4,500 and something. So you see, so once a doctor is being infected, it goes round. You spread it round. You take it home to your wife, to your kids, to your parents. So as I said, it's so pathetic, and I pray we'll do something against it.
Now, you know, I said we had two theories. The second theory is that some of the tests, come out negative for people that have the symptoms. Do you think that perhaps the PCR isn't picking all of the variants that points to COVID-19?
No, I don't think so, because most times, like now, if I'm having the symptoms, it takes me time to come to the hospital. And it takes the NCDC time to come and take sample. It also takes them almost 2 weeks to release the result. So during this time, a patient who has been infected could become well due to his strong innate immunity or because he's on treatment. So, well, I cannot rule out the fact that, yes, there might be some false negative and false positive, but to be candid, I feel that most times it's the delay in taking those test samples that make the results negative. And as I said, almost every doctor in clinical practice has been exposed. And I can tell you that more than 70% of us have been infected because we don't do tests, so we don't know. You cannot just come and tell me that the rate of infection is low when you are not doing enough tests.
Finally, and briefly, if you can tell us, are you optimistic that the vaccines are coming at the end of January?
Well, I am not a government official. The only thing I will say is that I pray it comes at the end of January because we need it now. And apart from that, as I said, the morale among we doctors is very low. We're having our NEC next week, and I will tell you that arising from that NEC, it might not be good news if something drastic is not done. We are trained in school to remove ourselves from danger first, but presently we are being exposed to danger, because if you don't remove yourself from danger first, there's no how you can take care of your patient. So I pray it comes, and I'm not a government official, so I can't tell you specifically if it's coming or not. But I believe that when they say something, they should live up to it.
We appreciate your time. A frontline worker, Dr. Adejo Arome, the first Vice President, NARD. Thank you for joining us, and stay safe.
It's my pleasure, ma'am.
Now, several EU countries are receiving significantly fewer doses of the Pfizer coronavirus vaccine than expected after the US firm slowed shipments. 6 nations called the situation unacceptable and warned that it decreases the credibility of the vaccination process. Sweden, Denmark, Finland, Lithuania, Latvia, Estonia urged the EU to apply pressure on Pfizer-BioNTech. Well, Pfizer said the reduced deliveries were a temporary issue. Here's more on the global update.
Frustration is mounting on Europe over reduced shipments of Pfizer's COVID-19 vaccine, while the United States pharmaceutical company increases production capacity at its Belgian plant. EU governments say it's costing critical time during the early stages of the rollout to care homes and hospital personnel. Italy and Poland have threatened to take legal action in response to the reduction in vaccines. Meanwhile, Hungary has signed a deal to buy 2 million doses of Russia's Sputnik V COVID vaccine, the first EU country to do so. The agreement comes days after Hungary's drug regulator gave approval for use of Britain's AstraZeneca and Russia's Sputnik V vaccines against the virus, as Budapest strives to lift coronavirus lockdown measures to boost the economy. The EU's medicines regulator has yet to approve the Russian or AstraZeneca vaccine. Meanwhile, President Tayyip Erdogan of Turkey says China has approved delivery of a second consignment of the CoronaVac vaccine, and 10 million doses could arrive in Turkey by this weekend.
Continue to take responsibility. You can take a closer look at our website, channelstv.com, at your fingertips. It gives you a better understanding of the pandemic. We can see here that story, the federal government releasing money for new oxygen plants in 38 locations nationwide. You can also find several other stories in politics, business, and sports. Thank you for watching. I'm Millicent Wonga. Stay healthy, stay safe.